Ever wonder what motivates people to get plastic surgery?
Did they regret it?
What can we learn from the weird and wild stuff that happens at our plastic surgery clinic? We're gonna tell some stories, get some laughs, and learn on
Clinic Talk with Sabrina Sajan
on the Plastic Surgeon Podcast.
Hello, my friends. I'm Dr. Javad Sajan, and of course, I'm here with my lovely wife and CEO of ALLURE ESTHETIC, Sabrina Sajan.
Welcome back and thanks for listening. Please rate and review us on Apple Podcasts to support our channel. On Clinic Talk, we tell real stories of fun, strange, hopeful, and educational that happen at our clinics from day to day.
We get a lot of weird and hilarious things happening at the clinic.
You can find the clinic at ALLUREaesthetic.com for more information. So, Janu, what clinic stories are we going to talk about today?
John, I had an applicant that had to run out of the OR during her interview and she passed out.
Oh my God. Was that the nurse that came to shadow?
Yes. No, it was the surgical tech.
Oh, yes, you're right.
We had a surgical tech you brought in for a shadow. What is a shadow?
Yeah, so we have a few step interview process that we do. We usually will do like a phone screen or like a screen, with some questions first, and then we'll bring them for an in-person interview. And then the third step is they come.
Obviously, social distance with masks.
Of course, yes, 6 feet and all of that good stuff. And then the third step of the interview process is a job shadow day, where the applicant would come in for a few hours, shadow the department that they're applying for. So if it's the OR, they'll shadow the OR staff. If it's accounting, they'll shadow the accounting staff. So this person was a surgical tech who was invited for the third step of the interview process, which is our job shadow day.
And during the shadow, they're not doing patient care or anything. They're basically a fly on the wall, just observing what the team's doing, right?
Correct. So they just come in, kind of watch and see what everyone's doing. We get everyone's consent. We get the patient and everyone's consent to do that. And then when they agree, then we can have them shadow. They're able to ask the other staff questions. They can kind of get to know the team, get to know the doctors, and all of the whole process of the OR.
And guys, we do like Sabrina said, we do this intensive process because we really believe our biggest asset and investment is our team.
Exactly.
And we don't just hire on the fly. I mean, we're really blessed that when Sabrina, activates or has her assistant activate an ad, we'll get 300 to 400 applications within a week.
Yeah, it is. It's quite some time to go through those applications.
Exactly. We go through and we read everything. Then we bring people in for an interview. And then, it's a multi-step process. And after they get through all of that, they still have to go through contracting and credentialing, which is another whole feat.
Correct. So this person came in, when a shadow comes in, especially for the OR, we have them change into our cleansed, our clean scrubs that we get washed from medical grade company. They change into our scrubs. They have to put, OR shoes on. They have to put on all the OR surgical items, such as a mask, N95. They have to put a bouffant on, booties, another mask on top of their N95 with a face shield. So all of this stuff they have to do because we want to make sure they're safe while shadowing. And of course, we're keeping the patient and the rest of the team safe. So this, this person, of course, comes and then, I take her to, grab her scrubs that are her size. Then I ask her, what kind of N95 do you want? And then I make sure that it's something that fits her and that she's able to wear. I give her all of her surgical items to change into. And then she's in the bathroom for like 30 minutes.
Wait, she was just changing in the bathroom?
Yeah, it was
30 minutes into scrubs?
Yeah, it was really weird because I literally wanted to knock and to make sure that she was okay because no one has ever literally taken 30 minutes to change and put on like their surgical attire. You know what I mean?
Or maybe she was sick. Did you hear any noises?
No, I didn't hear anything. I said, are you okay? She's like, yeah, I'm just changing. I'm like, okay, let me know when you're ready. I'm waiting right outside.
So no vomiting noises or?
Nothing.
Not a lot of air gas bubbles sounds?
Nothing. I mean, of course, we screen everyone when they come into the front door.
Yeah.
We ask them if they have symptoms, have they, felt a fever and all of that. And she said no to everything. So she was cleared.
So you just waited 30 minutes? I would have knocked. Hey, everything okay in there?
Yeah, I just waited. No, and then at the end, I did knock. I said, "Are you okay? Do you need some help?"
Yeah.
And she said, "No, I'm fine. I'll be right out." And I'm like, "Okay." So I'm waiting.
Right. So that's a red flag number 1 right there.
Yeah. So I was like, maybe she just takes a while to get her, get change and get her stuff together. Maybe it's the first time she's wearing surgical attire. She's trying to figure out.
But this person was an experienced tech. They weren't a first timer.
Yeah, and she said that she's worked in a hospital before, so this shouldn't be like a new thing.
It's weird.
Yeah, that was really weird. So she changes, and of course, I introduce her to the team, and I said, "This is so and so, and she's a surgical tech, and she's going to be shadowing us. Everything goes well." And then you saw her, right?
Yeah. So then she gets handed over to me, in the OR. So Sabrina gives everyone a brand new N95 for their safety. We do that for we invest a lot in the interview process. Sometimes applicants think. And we love applicants. We love you all. Thank you. But they think it's just their time and cost. But actually, it's a lot of cost for us because we got to dedicate a high senior leader like Sabrina, or she dedicates one of her assistants to get that person there. Then that's time and cost. And then we give everybody a medical grade N95.
Mm-hmm. And they have our scrubs too.
Yeah, and then we fit them for that N95. It's how here's an N95 wear. We help them wear it and do all that fitting stuff.
Fit test, yeah.
Yeah. And then so Sabrina hands her over and she's in the OR. She has her fancy schmancy 3M N95. We're not sponsored by them. Mm-hmm. But anyway, so everything is good. And then she's in the OR and suddenly she's like, starts like her eyes become red and she starts watering a little bit. And we're like, hey, are you okay? She's like, yeah, I'm fine. And then she's doing her thing. And then we see her like pacing a little bit back and forth. And we're like, hey, what's going on? You good? She's like, yeah, I'm just having an allergic reaction to your mask. I was like, I'm sorry, I didn't hear what you said. Because I was like, no one's ever had a reaction to an N95 mask. So I'm like, maybe she's an anti-masker. So we're like, hey, you don't want to wear a mask? What's the situation here? How can you explain more? She's like, no, this mask is making my eyes water and I'm getting an allergic reaction. And she just runs out of the OR back into her safe space, which I think is the bathroom that you explained. Now it makes sense. And she slams the door. And then she goes in there and then she goes, slams the door. We hear the sink. We think she's washing her face. And then she comes back out with the same N95. And then we're like, hey, are you okay? She's like, yeah, I think I'm reacting to the mask. Does anybody have Benadryl? And we're like, you're interviewing here. You're not a patient. I'm not giving you medication. We're like, no, we're sorry. We don't have any medication we can give you. Should we call 911? Or we're like, what's going on here? We're like thinking, is this person okay? Is this some kind of weird booby trap? Like, is there like a camera? Someone's hiding here. They're going to say, So then she's like, oh, I think I might have some in my purse. And she runs again to her safe spot, the bathroom, and slams the door. And then she comes back off, this time without the N95, with some random home mask, okay? And we're like, oh, okay. She's like, I'm better now. I have my home mask or whatever she said, some mask. It was orange. Orange-brown. Looks weird. Anyway, so then she's like, I found Benadryl in my purse and I took it. And I'm better now. And we're like, well, we're sorry. Thank you for coming, but we can't have you here since you're having a medical issue and you don't have a proper PPE, personal protection equipment, to observe us. It's not safe for you. The virus is here, the bad virus. So I hate saying that name, but you know what I'm talking about, right? Yeah. So anyway, so we sent her out and we're like, thank you. Have a nice day. And then she goes back quickly, doesn't even say bye, to her safe spot. Now we're in the fourth bathroom trip. She keeps slamming the door. I don't know why she's doing that, and then she just leaves without saying bye, and she threw her scrubs on the floor.
Yeah, I remember because someone came and got me, and they're like, oh, the shadow just ran out. And I'm like, what? They ran out? So then I go and I check to look for her to see where she went. And she's nowhere to be found. She probably literally ran because I literally was like, went to the elevator looking for her. And then I went back to the bathroom to see what happened. And she threw the scrubs on the floor and all her PPE that we had given to her on the floor. So disrespectfully.
So rudely. And if you're an experienced hospital OR person, everybody knows you put the scrubs in the hamper. That's just courtesy. You don't throw them on the floor of the bathroom for somebody else to clean up after you.
Yeah.
I just thanked, God, that we had this person do a shadow, because she interviewed so well.
Mm-hmm.
If we would have brought that person on the team, it would have been a disaster.
Yeah. And then it's weird how this person has the audacity to ask for an update on her application.
Get out.
Yes.
She asked for an update.
Yes. Literally, it was like probably 48 hours, like 2 days after, she sends a message saying, oh, I just wanted to get an update on my application for the surgical tech position. And I'm like, what? Yeah.
That's weird.
Mm-hmm.
Wow. Interview process saves another one,
Yes,
right?
Because it sure does.
If you bring somebody on who's not a good fit, everybody loses. And I'm sure this person's a wonderful person. I'm sure she's great. But we can't bring someone like that on the team because it's just not going to work out for their safety, right? They can wear N95s and, they have these issues. We just can't deal with it. It's not safe. And we saved her from losing her job that she was at. Mm-hmm. We saved us from having the pain of having someone and then not having them work anymore. And shadow process saves another one. That's all I can say.
Yep.
So, John, I heard you guys called the police. So what was going on with yesterday? I heard you on the phone. Not you, or I heard you telling the phone person to deal with something. What was going on? Yeah.
So we had a patient that scheduled an appointment to see one of our providers. And, we have a cancellation policy on our appointments where they have to keep a credit card on file and they have to at least let us know 1 business day prior to cancel their appointment. I think that's very fair. Providers, a lot of our providers are booked out for months. So a lot of patients are waiting for months to see some providers. So it's really important that patients, if they do want to reschedule or cancel their appointment, they let us know at least 1 business day before.
Mm-hmm.
This patient, of course, didn't let us know 1 business day before canceling their appointment, just didn't show up. So, they got charged the fee. And then they called back and said, well, so-and-so happened and all of this stuff. So we said, okay, fine, we'll refund you the fee. We'll help you make another appointment. But going forward, we have to let us know at least 1 business day before. So then the patient, is fine. They reschedule. And guess what again? They cancel the appointment after their appointment. Like, we can't cancel your appointment after your appointment time has passed. So happened again.
This reminds me, one time I had a staff member who, way in the beginning of 4 years ago, who told me their same grandma died 5 times. Literally. You only have, that's right. I know. Oh, it was another staff member. I gotta save this. Who called out the day before for food poisoning, and then the day of, this is pre-virus 3 years ago, she called out, and then the next day, we all went she said she ate bad seafood. Then the next day, we all go to P.F. Chang's to celebrate. And then she orders shrimp. Anyway, we got to clinic talk that thing. Sorry, go ahead.
Yeah, so this patient literally makes up excuses. It was literally the 3rd time that we're on now. And then we're like, well, we can't, go move forward with, scheduling your appointment anymore because, you failed to let us know about, rescheduling or canceling your appointment. They get super upset and they're demanding that we schedule an appointment for them and refund their $50. We're like, unfortunately, we can't. This is literally the 3rd time. We've given you 2 other tries. Mm-hmm. This is our policy. We've made exceptions twice already for you. We're happy to, schedule it, but we cannot give you a refund. Like, that's just our policy.
Like a mid-level, or like a esthetician or nurse appointment?
Yeah.
Okay.
And
was it a man or a woman?
It was a man.
Oh, okay.
Yeah. This man is like he's like on the phone, like yelling at the front desk staff on how like we're just taking his money and his $50 and all of the stuff, and that he's going to call the police on us. So that first he said that he's going to show up to the office with police, so that he can get his $50 back.
How are the police going to help him?
I don't know. But he's like, yeah, I'm going to call the police on you guys so I can get my $50 back. You guys are keeping my money. And we're like, we're not keeping your money. We gave you 2 other chances. We refunded your money the first time and the second time. And we said to you that going forward, we can't have this anymore, And this patient was super upset and literally was threatening us and how he's going to just show up to our office and take the money from us.
That's like, what was he? It was with the police.
Yeah. Well, the police is not going to help him.
No. That'd be so funny if he called the police. I wonder what they would say.
Yeah, I don't know what they would say, but he kept threatening us with different things and how he's going to show up and he's going to get his money from us, basically. And the reason we have these rules in place is because, like I said, a lot of patients wait for weeks or months to see some of our providers, and it's the provider's time that you guys have to remember. It's they're waiting for an appointment, and this person doesn't show up when another patient could have been seen during that time. So yeah, that's that.
That's wild. You gotta be respectful of the rules.
Yeah, we get all these random calls, and sometimes
you made a lot of exceptions. After 2 strikes, you gave 3 strikes.
Yeah. And they just could not follow the rules. And if they can't follow the rules, then they probably won't follow the post-procedure rules either.
I know.
Correct?
And the rules help really separate people who aren't a good fit for the practice. And you know this. We love our patients. We thank our patients every day for being part of us. And it's so nice. But if someone's going to be so non-compliant with their cancellation policy, how are they going to follow post-treatment injections?
Exactly. Instructions.
Even if they get microneedling, let's just say, or laser, you have to do care after your procedure. And if you can't just show up first and then you're going to be so difficult, like how are you going to treat us after it? That's what I think sometimes people forget. We love, 99% of our patients are amazing, but you get 1% of people that no matter what you do, you can't make them happy. And sometimes the rules help those patients not come.
Yeah, exactly. Sometimes patients demand things that we're just like, you can't meet your expectations. Maybe you're just not a good fit for you. Like that call we got on Friday.
Oh yeah, that was something else.
Yeah, so we get a call on Friday from a patient, and they're trying to come in for an appointment.
That was a Botox appointment, I think.
Yeah, it was a Botox appointment, and they first they ask, have all of your staff been vaccinated? And of course, we say, it's everyone was offered the vaccination, but it's a personal preference. We can't force staff members or anyone to get the vaccination. It's their decision at the end of the day.
We highly encourage it. We think the vaccine is great. We believe in it, but we can't force a human being to get it.
Exactly. And this patient is demanding for the phone staff to tell them if every employee at our office got the vaccine.
What?
Yeah, she says, I must know every employee if they got the vaccine or not. And we'll say, unfortunately, we can't give you that information. That's HIPAA information, first of all. And second of all, that's a personal choice. If someone wants to get the vaccine or not, I said, we're happy to not see you if you don't feel comfortable coming here. But that's the type of information we cannot give you.
Yeah. And I think people know this, but even if you get the vaccine, okay, let's say you get COVID, you're going to get less sick, but you can still spread it. So.
Yeah. And then she was asking, when were the staff offered the vaccination? What % of the staff have received it? Have all your providers received it? Like all these detailed questions about it. I mean, I understand she may be worried and, she wants to know this information, but this is information we cannot give.
No, it sounds like a spy almost. Maybe somebody from another office.
Yeah, it was very weird. She was like asking all these specific questions about the vaccine and the employees and all of that. Yeah,
that's a do not, that goes on your special list, do not schedule.
DNS.
Yeah, so we have a special list in the office. It's Sabrina's list that she manages, right? It's called DNS list.
Yeah.
So those are all the people that aren't allowed to get appointments. Yeah.
They could get on the DNS list, and unfortunately, they're just not a good fit for our practice.
Yes. I remember how this one happened. I was sitting talking to Sabrina, and Sammy came running. Sabrina, we got somebody on the do not schedule list calling.
Yeah.
Something else. So guys, I got a bad Yelp review.
Boo.
So here's what happened. So I didn't do surgery on them. Okay, thank God. So we had a patient lined up for surgery.
Dodged that one.
Yes, I dodged a bullet on that one. I'll tell everybody what happened. I'm not going to give any personal information here. So here's what happened, guys. So I had a patient sign up for a surgery. I won't say what it is. So then this patient signs up for surgery, and during their workup for surgery,
because you requested medical clearances.
Yes, medical clearances, and during their history and physical that the regular doctor does, there was a history of a heart murmur. So a heart murmur is just an irregular sound your heart can make. And for some people, it's normal. I had a heart murmur for many years because I was born premature. I was born, only a couple of pounds, spent 3 months in the NICU. But nevertheless, long story.
Hey, you're a big boy.
Yes. Yes. Yeah. So I had a heart murmur for most of my life, and it's probably still there a little bit. But basically, I had a hole in my heart that closed up by itself. So this person had a heart murmur, and my anesthesia provider, Patrick, he's super vigilant. So this person was getting a longer surgery, about 5 hours. And during the surgery, there would be what are called significant volume shifts. So what is that and why does it matter? So when you're doing a longer surgery and there's a big shift in volume, means fluid is going to move around a lot. Either you're giving IV fluid or you're taking a lot of fat out. That puts stress on the heart. And if your heart has a hole in it or something like that, although it's been totally fine at the resting state or normal activity, when you're stressing somebody for a procedure, because surgery and anesthesia put stress on the body, that thing that was normal most of the time can become a huge problem. And if you have a heart murmur, even though it might be benign or not a big deal, but during surgery, it can become a very big deal. So Patrick, who's super vigilant, reviews all my patients' information. He calls me up, hey doc, we got a heart murmur. This person, because of the way the doctor documented it, I think we should get a echo by a cardiologist. I'm like, okay, Patrick, that sounds fine. And this is happening during COVID, right? Now, in post-pandemic, in the pandemic world. So I'm like, yeah, let's get an echo. And this patient already, has surgery scheduled already. And because of the COVID thing, they couldn't get the echo. Or an echo is an ultrasound of the heart. It shows why the murmur is there. They couldn't be done until only a few weeks before surgery. So they go and get the echo.
And let me tell you, our staff worked every single day to make sure that this patient would get in to their cardiologist so that they could get this test. And I still remember till this day, our pre-op coordinator, she literally called that office almost every single hour. We
hustled for her.
And sent in so many letters and so many requests trying to speed her test up because of the COVID, they didn't have that many availability. And every single day we reached out to their office, send them letters, push them like, we have to get this in for this patient. Like their surgery schedule, we have to get this echo in. And I remember till this day, even till the week of surgery, our pre-op coordinator was calling their office over and over and over again to get these records and to get the tests done because we needed it before surgery. We wanted to make sure the patient is ready to go for surgery. And we worked timeless to get that in and get her scheduled.
Yeah. And so finally we got the echo done a week before surgery. I
remember she got the echo done and then the office wouldn't send us the records.
Exactly. And this was the whole story. So she gets the echo done. Then we get a phone call from the medical assistant at the office. Love medical assistants, but just randomly calling us saying, hey, patient's fine for surgery. And they tell this to our pre-op nurse, and we're like, whoa, what's going on here? We want the echo results, and we want a letter from the doctor saying she's safe.
And then I remember she says, well, that's a process and it's going to take maybe a few more days. We do have the results, but they need to be scanned into our system. Then the doctor will review those results. Then when the doctor signs off on the results, then we can send them to you. So it will take a few days. And this patient's surgery is scheduled in a few days.
Yeah. And so we're like, one, your phone call is not enough. It's not that we don't trust you, but we have to follow a process. And if you're telling us the doctor said it's okay, send us a letter and send the results. What's the big deal? And so we had to do multiple phone calls. Then Patrick had to call the office and be like, we need the records now. And he got a little bit excited about that. So then basically we get a 1-line letter that says patient's fine from surgery signed by this person's cardiologist. And we're like, no, the letter just says patient's fine for outpatient surgery.
No, we said we need the records.
Yeah. And the letter doesn't say what surgery she's having or the results from the echo. And Patrick's like, I'm not going to accept this. So then we have to call this office back again. And now we know them by name. And we're like, hey, this letter, one sentence is not enough. We need to make sure this patient's really safe.
And I remember Patrick requested to speak to the cardiologist
Correct.
directly.
Correct. So then Patrick talks to the cardiologist directly, and the cardiologist says, yeah, this patient has a leaking heart valve. She'll be fine for outpatient surgery. And Patrick's like, well, you do know this patient's going to get at least 3 to 4 liters of fluid during the surgery. It's going to be a lot of volume shifting. It's a 4.5-hour surgery, 4-hour surgery. And the cardiologist is like, oh, wait, let me look at those records again. The results of the echo again. And he's like, okay. And then she puts him on hold for a good 15, 20 minutes. She picks up. She's like, if you guys do this surgery, this patient will die. And Patrick's like, what? And she's like, yes.
Meanwhile, a day ago, the medical assistant said the patient was cleared for surgery.
Exactly.
And they sent a letter.
Wow. And the cardiologist is like, I didn't know all the extent of her surgery, but her heart valve, it was her mitral valve, y'all can look that up, is leaking 60%.
Wow.
And if you guys give as much, I think it was 70%. And if you guys give the fluids you're going to give and do the surgery, this patient could potentially go into heart failure and she could die. And we were like, wow, cancel the surgery now. So that just tells you all how vigilant you have to be. So now let's come back to how this led to a negative review. So then this patient obviously, got all their money back. We gave them a full refund.
I remember we called them the same day and we apologized. We said, unfortunately, our first priority to keep the patient safe. The second is to do the surgery.
Absolutely.
So the patient, of course, since, we discovered this, health problem for this because of, whatever results that we got from the echo, the patient was extremely upset at us, extremely upset at the pre-op coordinator, yelled at us over the phone. And, of course, we told her that, we understand all of this happened. We're happy to give you a full refund, even after going all this way and, trying to work this out to the last minute. We, it is what it is, but we'll give you a full refund so you have your money back. But unfortunately, we can't proceed with the surgery. And she was really upset, and she hung up the phone on us.
Yes. And we sent the full refund. Patient deposited the check and all that. And then 3 months later, we get a scathing 1-page negative review about how our practice is the devil. And we canceled this person's surgery. And they didn't even talk about everything we did to make sure they were safe.
Yeah.
All it said was basically it was a 1-page letter saying how we're demons.
And we didn't want to do her surgery.
Yes. And Patrick's definitely the devil, and I'm the devil's accomplice. And that don't have surgery here because they're going to cancel on you last minute. And we're like, we just saved your life.
We literally tried every single day to make sure she gets the echo because we didn't want to cancel, because we wanted to make sure she gets the result in time to have surgery. Now, we didn't know what the results were going to say,
I know. And it's not like we even kept a penny. I understand it's sad and it's inconvenient. It makes life worse, to cancel surgery. Nobody wants to do that. But who's going to take a risk and jeopardize that person's life?
And our team worked so hard to, do all of this for her. We went out of the way sending letters, went out of the way calling their office, so many multiple times. Patrick reviewing all the records over and over again, spending so much time and effort doing the pre-surgical workup. All of that's, we're not even talking about all the time spent of our staff to do all of that. It is unfortunate, that we had to cancel it. But like I said, first priority is to keep the patient safe.
In what we do, guys, we can't even be wrong 1% of the time because of the volume of surgeries that we're blessed to do, that I love doing. If we make a mistake 1% of the time, that is a death every 1 to 2 months. And we can't afford that.
No.
We would much rather cancel a surgery than risk someone's life, because that person on the table is someone's wife, it's someone's mother, it's someone's sister. And every time I do surgery, I remind myself of that. And that's the quality of work I do. And that's the quality of care we give that patient.
Yep.
And in doing that, I would never risk their life because I wouldn't risk my family's life for an elective outpatient surgery.
I totally agree.
Well, everyone, on that note, thank you for listening to Clinic Talk on the Plastic Surgeon Podcast. Please rate and review us on Apple Podcasts to support the channel.
Tune in next time for more clinic talk. We have more great stories coming your way.
For my live surgeries on Snapchat and adventures throughout the week, catch us on all social media at Real Dr. Seattle.
See you next time. Bye.
Bam. What?